injection is very important. I think this is the key of the RIT or signature program. And we have injected the bone marrow marrow and oral commission to against the turn down of the recurrence. And this whole injection is against to the aging process. Okay, and you see the skin beam injection for the skin hydrate and the skin armor. You can see the very natural region and not excessive volume appearance. And after consultation, if needed, second session can be considered with patient. At this case, AA signature RIT approach includes the communication and anatomical structural approach and focus to the natural appearance and no downtime. It can give to more satisfaction to the patient. If we deeply understand and utilize it well, I think the AA signature program is a revolutionary aesthetic medicine through strategic injector patient partnership. This was conceptual. Thank you.
Thank you, Dr. Chuan, to share his patient journey, especially after just less than an hour, that created the clock back and the patient is satisfied. So next we will invite Dr. Dr. Wang Yi from China to present his patient journey. Welcome.
Thank you, Dr. Wang. I'm Wang Yi from China. What you're going to about here today is based on the real story that happened to me. And it all starts with a phone call. It was from my elegant staff. They said, Dr. Wang, we're going to have a effective summit in Hong Kong. Right? So we are assigned to a topic of distinct definition. I think, wow, it's clear I can be on stage, right? So like every faculty does, I search through my patient database, trying to find the perfect case until I met this one. This is a 60-year-old female patient. She's seeking for treatment in 2023. Look at her. We can see the sagginess in the mid and the lower face. We can see jawline. We can see the unclear jawline. We can see double chin, the nasolabial fold, the marionette lines, everything. So after the treatment, she looks like this. Right. Much better, right? I said, face lifted, tightened, more clear jawline, less double chin, improved nasolabial fold, and marionette lines, right? So when I find this case, I was so excited. I said, nailed it. Okay, this is the case. So I immediately contacted my assistant. I said, let's find the latest treatment record so we can see the recent photos. Okay. But my assistant tells me she has never come back after the treatment. I said, what? It's a very good result. Why didn't she come back? What's wrong? So we did our best to ask her to pay a revisit so we can find out why. Finally, she came. And she said, the result is good, but there's always a but. I hate but. But my face looks bigger. Let's take a closer look. Is the result good? Yes. Is her face bigger? Sadly, yes. So what goes wrong? Which part goes wrong? Well, now I'm telling you, everything goes wrong. Okay. But that was because it was in 2023. And this year, we were introduced with the AA signature. We all know it has several sections, modules to help us reach the patient satisfaction in our clinic, okay? So this year, I plan to treat a new patient following AA signature. This is a 35-year-old Chinese patient, female, of course. And I asked her, what do you want? She said, I want more contour in my jawline. I want less double chin. I want less sagginess. So immediately I recognize her as a distinct definition patient. So we'll proceed to consultation. Well, consultation is a very long and complicated process, like a carousel on day one. So I'm going to cut it short for you. So sum it up. You want to be slimmer, more energetic, and more youthful. Okay? But this time I learned. Besides asking what she wants, I asked her what are her concerns about the treatment. Look at what she said. She said, I don't want a bigger face, no widened face, no masculine face, no pillow face, no Mar-a-Lago face, no stiff face. There's a whole list, longer than my shopping list, I said. So at that moment, I realized this patient is just seeking for mild to moderate improvement, but nothing that should concerns should happen after the treatment, and definitely not a face change. So then we proceed to facial assessment. Let's take a look. In front of you, I think the upper third is almost perfect, just the glabella. She needs a little bit of Botox. And for lower and mid third, we notice the asymmetry between the left and right. And also, we can see a mild volume loss and a sagginess on the right cheek. And for the lateral cheek, we have a more severe volume loss on the right side. And we also can see jowling, we can see magnetic lines. And let's take a look at the chin apex. I don't know if you have noticed, her chin apex is a little bit higher. Okay, it's not low. So that gives her a nervous look. That makes her look like she's always contracting her mentalis. And let's take a look at the profile view. We can see the retreated chin. We can see the inverted lower lip. And we also can see the double chin. But watch the mandibular angle. On the left side, the mandibular angle is blurry, but we can see the shape. On the right side, the mandibular angle is almost gone. It's an oval shape. We can barely call it an angle. So after the facial assessment, we'll proceed with the treatment plan. For sticky points, we use Voluma, of course. For sticky one, I use a 0.5 inch side with a cannula. On the left side, we do the standard treatment. But on the right, I also use a cannula, but when I enter the needle, I enter from the upper ring of the zygomatic bone. And when I enter it, I didn't go parallel, okay? I tilted up the cannula tip, so we can form a more oblique zygomatic bone. And for CK4, since we have more volume loss on the right side, so I give more volume on the right. And for CK3, I only inject 0.3 on the right side to the bone, because her left side is almost perfect. And for Gtox, well, her last Botox treatment was 2 months ago, so we'll put that on hold for the second treatment. Then we'll proceed to GW points. That's the jawline. So for GW1, she doesn't want a widened face. So needle on the bone is definitely out of the picture. And so we use cannula to treat the GW1. Also, it's the same. On the left side, I use cannula. Okay? We're trying to 0.5 volts, trying to enhance the mandibular angle. And for the right side, it's more difficult. Since she doesn't even have a mandibular angle, so I have to reshape the mandibular angle. I use more volume on the right side, trying to form a new mandibular angle for her. And we make sure the angle between the ascending branch and the mandibular body is between 100 and 120 degrees. Because if this angle is more closer to 90 degrees or even less, the bigger the face looks, or more masculine. and then proceed to GW 4 and 5. That's the standard treatment. Now we proceed to the chain codes and leg codes. For the chain C1, C2, that's the normal protocol. But for C2, remember we're talking about the chain apex. So I leave 0.3 volts to enhance the chain apex. We're trying to elongate the chain and also bring the chain apex a little bit lower. That will give her a more relaxed look. For L6, it's Luma. And for lips, look at her right upper lip. It's thinner on the left side. So, it's thinner on the left side, yes. And so we put more volume on the upper right side. Okay? And since she has a very inverted lower lip, so we put more volume of Babella in the lower lip, trying to invert. So let's look at the video. That's marking. Even though for CQY I mark 3 points, but I injected with a camera. So GW 4 and GW 5, that's L6. C1, C2, and CQ3. Okay. Well, personally, I remove all the markings before I start to inject. That's CK1, okay, with the camera. CK4, remember we give more volume on the right side. And CK3, only on the right side. Now GW1, remember we try to reform our mandibular angle on the right side. And then intentionally to avoid inject overlapping the maxillary muscle, especially the peak. Because if you inject there, you're going to widen the face. And C1, C2, GW 4 and 5, that's standard protocol. Nothing new. And this is L6 with aluminum. And the lip codes, remember we inject more on the right upper side, and most of the volume goes to the lower, okay? Now let's take a look at the result. I know it's not a wow result, but that's not what I'm worried about, okay? First things first, let's take a look at the picture. Is her face bigger? No, I don't think so. Is her face wider? No, definitely not. Is her looks more masculine? I don't think so. So, I'm half relieved, okay? None of her concerns happen. That's more important for me now, okay? So let's proceed. Let's look at what changed. Is her face looks more symmetrical after the treatment? Definitely yes, I think so. And look at the zygomatic bone on the right side. It looks narrow and more oblique, so give her a more lifting effect. And look at the medial cheek, the CK3 points. It's more symmetrical, less sagging on the right side. And like, what about the CK4? It's more symmetrical between the left and right, okay? That's done with the CK points. Now let's look at the GW points. Does she get a more clear jawline? Yes, of course. Let's double check. A little bit projected chin and everted lower lip, right? Now, the worst side, that's the right side. Remember, this side we can barely see the mandibular angle before the treatment. Now we can see the shape of the mandibular angle, okay? So it's definitely better. Now let's take a look at the 3D imaging. It will remove all the shadows so it will be more clear to see. Look at it. Her face looks slimmer. Right? If you look closely, it looks slimmer. And what about the chin apex? We lower the chin apex. So if you look at her around the perioral areas and the chin, she looks less nervous and more relaxed. We get a better proportion between the nose lip length and the lip chin length. Okay, and the profile view, you can see more clear jawline and less double chin. The worst side, we can see more clear jawline, and then we can see the angle of the mandibular. And finally, the marble imaging. I'm going to tell you, I never loved marble this much in my life. So it's so easy to see the difference, okay? Face lifted, tightened, less sagging, less jolling, more clear jawline, less double chin, and a more projected lower mouth that contains the lower lip and the chin, more projected. So it's more balance in her face. And the worst side, look at the mandibular angle and the contour of the jawline. It's much better. So I say it's a good case, okay? But now, the problem is I'm having a dilemma. Which one to choose? The first one's very, very good before and after photos, but the patient doesn't like it. The second one is good, but not that good. But the patient loves it. She still brags about it half a year after the treatment. So which one to, I'm stuck with 2 cases until one day I had a chat with the AMI staff in China, and suddenly I had the epiphany. She said, we treat patients, not photos. Thanks for listening.
Thank you very much. Okay, Wang. So